As you will recall, when we instructed the same sometime in March and April, it was very clear, and the protocols are clear. And I'm going to ask Dr. Amoth to go through some of them and to remind Kenyans what those protocols are. Vis-a-vis funerals, you will recall that sometime in April, March, in fact, some mortuaries were closed because you are supposed to dispose of our loved ones as soon as they pass on. Today, you will hear of funeral meetings all over the town. You'll hear of wedding meetings all over the towns. I am urging Kenyans that this has to come to a stop. We have to adhere to the former laid down protocols, and we have to be realistic about the current situation. Our advice as the Ministry of Health is that instead of attending a wedding, please send a gift. Instead of attending a funeral, please send a contribution if you must. But I think it is in your interest not to attend those functions and leave them to the families. Let these things now forthwith be dealt with by families. I hear of Thanksgiving events. Please appreciate, these are not normal times for Thanksgiving events and other uncalled for events. I think, fellow Kenyans, we will begin, and I think we have already begun, to see what we have been saying. We are now seeing what we have been saying. We have been saying if we don't take containment measures, this is what is going to happen. If we don't do the other one, this is what is going to happen. Please, please, we urge you, let's make sure that we remain within the bounds of what we have agreed. We must not run away from our responsibilities as individuals. And on our part, we continue to advise that we adhere to the laid down protocols. These protocols are not for some people only. They are for all of us. We should all pull together, and by doing everything necessary, we can avoid these infections. We want to carry every Kenyan with us in terms of taking measures. We want every Kenyan to be our friend. There is no foreigners that we are dealing with at the moment. We are dealing with family. And as a family called Kenya, we must all pull together to ensure that we can contain this disease. And this is one time when pulling together means keeping your distance. Because it is the only way that when you keep your distance, when you constantly wash your hands, when you constantly wear your mask, it is the only way that we can do our bit. And I cannot stress this enough. To all in the country who suspect or test positive for COVID-19, we continue to urge you not to expose anybody, including our healthcare workers. If you go to a health facility suspecting that you are COVID-19, please ensure that you have appropriately worn your face masks and inform nurses that you have COVID-19-like symptoms so that they can take appropriate protective measures. Better still, you are strongly encouraged to contact our hotline 719 before visiting our health facility so that you can be advised on the appropriate measures by the public health officials. As we continue, today, another 559 people have tested positive with a sample of 3,074 in the last 24 hours. We have therefore got 70,804 people who have been confirmed positive in our country, which means our cumulative total is now at 793,026 persons. 541 are Kenyans, while 18 are foreigners. 336 are male, while 223 are female. And in terms of sub-county distributions, some 278 cases in Nairobi. Lang'ata has 42 cases, while Starehe has 31 cases, and Embakasi and Kibera has 24 cases each. That tells you that if you live in Lang'ata, then there are high infection rates within that area, and therefore you should be very, very careful. Similarly, in Meru County, Imenti North has recorded some 47 cases, which also tells you that the Imenti North area is highly infected, and one needs to be very, very careful when you are in that area. It doesn't say that you should not be careful, but anywhere else. But I'm just saying it is good to be careful, more careful in those areas. Malindi has largely been, the Malindi town has largely also been infected largely, but today they have also got 25 cases. And therefore, if you live in Malindi, you should be aware that Malindi is also part of the highly infected areas at the moment. So, ladies and gentlemen, we will give the rest of the statistics to the media, and they will be there in tomorrow's media. But we have also recovered some 478 patients, most of them from home-based care. 337 are from home-based care programs, while 141 have been discharged from the various hospitals. Unfortunately, in addition to the figures I've read, we have also lost some 18 patients to the disease, bringing the fatality rate to our nation to 1,287. And our condolences go to those who are dead. I would like to also state here that even as we do so, we have got a lot to thank God about. Because if you look at our fatality rate in Kenya, which still stands at about 1.8%, and when you look at the average fatality rate across the world, it is anywhere above, even up to 4% in some countries. And even as we look at the situation as far as our workers are concerned, our health workers are concerned, the fatality rate among workers still remains lower than the average in the country at 1.3%, while the rest of the country stands at 1.8%. So we have a lot to thank God about. Tuna mambo mengi ya kushukuru Mungu, kwa sababu hata tukiona vile virusi inaendelea katika nchi yetu, vile ni lazima tufikirie vile Mungu ametujalia, vile nchi zingine ziko. Ukiangalia leo hii ile mambo inaendelea, ile virusi inaendelea upande wa Ulaya, Amerika na kwingineko, tunaweza kusema Mungu